Hi, this is Dr. Sinagra from the Sunrise Wellness Center, and today I want to talk to you about autoimmunity. The appointment of RFK Jr. is bringing a lot of health issues up to the forefront, and one of them happens to be autoimmune disease and chronic illness. Autoimmune disease has exploded in this nation, and I recently heard some newscasts where they propose that autoimmunity might become the third leading cause of death behind cancer and heart disease in the next few years. Typical autoimmune cases stem from rheumatoid arthritis, Crohn's disease, ulcerative colitis, MS, lupus, psoriasis, Hashimoto's, Graves. There's 101 of them. Now, when I talk to my patients, a lot of times I'll ask them when I meet them if they have an autoimmune condition. I'm like, well, why are you treating your autoimmune disease? And they're like, hey, wait a minute, Dr. Ron. There's no cure. I went to my endocrinologist. I went to my rheumatologist. He said there's no cure. All we can do is manage and treat the condition or the illness or the symptoms. Well, what if we got that wrong? What if we are wrong? What if there are real causes? So I want to tell you my story. I suffered with an autoimmune disease for 20 years. I suffered with psoriasis. I have an elder brother who's since passed away. He had special needs, but he was covered with about 75% of his body with psoriasis. Probably one of the worst cases I've ever seen, that's for sure. Due to our age difference, he was 12 years older than I. My parents would take him in see all the best dermatologists, into Manhattan, all along Long Island. So I understood psoriasis, at least I thought I did. Finally, I got so frustrated. I was in my early 30s, and one of my buddies said, hey, you got to hear about this thing called functional healing, functional healthcare. There's a seminar. Why don't you go take it? So I go take the seminar, and it changed my life, but I was blown away by what they were saying. So I go up and I speak to the professor, short little old guy, adorable, nice guy. And I go up and I said, Professor, I said, have you had any luck with people with psoriasis? And he looks me square in the eye and he goes, son, the day you realize you don't have a skin condition is your first day on your road to recovery. You got an immune problem. Fix your immune problem. That was life-changing to me. I had never heard that before. So I started looking, and when I started hearing about it more, this is what I discovered, that autoimmune disease, and again, there's over 100 of them, they all share a common origin. A microbial origin. Now, when I'm reading this, I'm fascinated. I'm reading about psoriasis at the time, and it says that indeed psoriasis is a microbe-induced autoimmune disease. I'm like, wait a minute. I got my doctorate degree. I've been to the best dermatologist on Park Avenue in Manhattan. I've never heard that. All I've ever heard is you have to treat and manage it because we don't know what causes it and it's incurable. Well, that is not true. We got it wrong. There are direct fundamental causes of autoimmune disease. Microbial origins is where many autoimmune diseases, if not all of them, and I think there's about 4 real prime causes of autoimmune disease. Microbes, heavy metals, parasites, yeast, fungi, and mold. If we were to clear out most of that or all of those, I think that most autoimmune disease would be pretty much a thing of the past. But when it came down to when I was learning, I started going through some books, and I found out, and I was looking through a book of viral causes of autoimmune disease. And I didn't realize this, and I was shocked. Epstein-Barr virus, chronic fatigue mono, all the same thing. Now remember, 6 billion out of 7 billion people on the planet have been exposed to this. We're talking about active Epstein-Barr. It's a direct cause of rheumatoid arthritis. And it can lead to Hashimoto's, Graves, Crohn's disease, ulcerative colitis. I never knew that. And I know people that suffered with it never knew that. I got my little list here of a lot of other ones. Cytomegalovirus can cause scleroderma. And of course, we have parvovirus B19, which also can cause scleroderma. This one was really shocking. Herpes simplex 1 can cause MS and Alzheimer's disease. So there's these initial infections, and then the chronic side can cause autoimmune disease. That was life-changing to me. Also with yeast and fungus and mold, prime cause of Crohn's disease and ulcerative colitis. So having to find this information out, I cleared up my psoriasis within a year. It was gone, probably even sooner than that. But when I founded the Wellness Center and we started taking care of autoimmune patients, one of the things that we do is we have a very powerful antiviral program. Again, most autoimmunity has a viral and microbial origin. Now, viruses are much different than bacteria. They can't replicate by themselves. Most people don't know that. Viruses are self-contained units. They can replicate. A virus must hijack human machinery. It must get into the cell and put its DNA information into the nucleus, and then that cell starts to replicate the virus. Well, all 4 phases of viral replication, acquisition, replication, mutation, even systemic effects and immune effects, all 4 of those phases are nutritionally modifiable, meaning that your nutrition and the level of your nutrition can stop the viruses. So when patients come in, we use a powerful antiviral program. Like for instance, zinc, selenium, licorice, lemon balm, they're very antiviral. They actually kill the viruses in your body. N-acetylcysteine and B vitamins, especially, I shouldn't say B vitamins, methyl donors, because it's B12, folate, and SAMe. That methylation process, DNA methylation, stops the virus from actually penetrating the nucleus and stops viral replication. Also, if you have barrier strength, if the cell wall is fortified properly, and that comes from fish oil and other nutrients too. And vitamin D and others, you can prevent the virus from actually getting into the cell. Selenium stops viral mutation, which is what we call immune escape. The virus is basically put on a funny nose and glasses and walk past our immune system. So by utilizing this antiviral program, we get to the root fundamental cause of this. Lastly, well, not lastly, but next in line, what we're going to do is calm down the inflammation. Now, we all see these drug commercials for biologics, Stelara, Humira, and they all come with a warning for cancer. Don't get a vaccine. Don't stay away from certain fungal areas, because they actually shut down the immune system. And that's why they have these side effects. Well, there's something called nutritional immunomodulation. With proper nutrients, you can actually take the T cells in your body, and I'll explain it in a little better detail. If you're suffering with autoimmunity, we have too many T cells, Th1, Th2, Th17, T helper cells, 1, 2, and 17. Your thymus gland, that's why they're called T cells, produces Th0, real transgender, haven't become anything yet. By using certain nutrients, glutathione, NAC, fish oil, vitamin D, green tea, we can actually push the Th0 cells to become Treg cells, T regulatory cells. They look at all your T cells and bring balance back into your T cells. We shut down that inflammation without the side effects of cancer and all the other things that come with the biologics. It's completely amazing and remarkable. What we want to do is restore the body's tolerance and function back. When we combine this with changing the diet from an inflammatory diet to an anti-inflammatory diet, and then bringing up all your nutrients to optimal level, we can completely change your trajectory. You can reverse the effects of autoimmune disease, regain your quality of life, and take your life back. You don't have to suffer from autoimmunity. You can reverse it and you can heal. So, I hope you found this information interesting. If you'd like to see me in person, please call my office at 631-563-1444. Love to meet with you in person and discuss your condition. Have a great day.